with infection control, you're trying to prevent these hospital-acquired infections, but also, you're protecting the staff so that they're aware, that when somebody is admitted with a potentially infectious disease, that they're sort of following the procedures to isolate that patient, right? So depending on the disease that they may come in, and actually you don't know, many times you don't know the disease right away, right? Somebody comes into a hospital, they have certain symptoms, and you have to try to figure out pretty quickly if that person has some sort of infectious disease, right? Because you want to, as I mentioned, isolate and put that patient under infection control precautions as soon as possible, right? So there's no spread in the hospital. And that's always a very challenging part, right? Because again, for one, you don't know what the person has. And a lot of times there are sort of symptoms that anybody can have, right? You can have a cough, you can have a fever, you can have, stomach ache or diarrhea or something like that. And it doesn't mean that you have an infectious disease, right? Until you get sort of diagnosed. But you have to take preemptive measures before the diagnosis, right? So that it doesn't spread. And so that's sort of challenging for a lot of clinical staff to sort of understand, because they're not, many times they're not thinking that way. They're thinking about the patient, right? And rightfully so. They're trying to get the patient well. They're trying to figure out what the patient has and improve the patient's health as soon as possible. So they're not thinking about isolating the patient. So, infection control is a challenging job because you're always educating staff about what to look for, what symptoms are important to sort of keep in mind. And, we always try to tell them that, it's better, prevention is better, right, than sort of having a case of an infectious disease like tuberculosis or something like that, right? You want to try to prevent that as much as possible. So, if you're not sure, but the presentation kind of looks like, it could be some sort of infectious disease, go ahead and put the patient on precautions, right? You can always remove them from precautions at a later time, but it's better to sort of prevent and have another patient get sick, right, with that infectious disease, or even a staff member or something like that.
What's up, friends? If you enjoyed that clip from Public Health Careers, then press here for the full unedited episode. And don't forget to subscribe and share. Peace.